One question that I get a lot is when it is time to see a spine surgeon if you have a problem with your cervical spine. Obviously, nobody wants to see a doctor or certainly see a surgeon if they don't have to, but it's a question that comes up a lot, both from patients and from referring doctors, so we're going to cover that important topic in this video. Neck pain and problems in the cervical spine are incredibly common. Most of the time when people have problems with their neck, like a musculoskeletal strain or crick in their neck or something like that, it really doesn't have much to do with the cervical spine itself. In this video, we're going to talk a bit about the symptoms of cervical spondylosis, but if you really want to understand those symptoms, I'd refer you to the chapter that covers the symptoms of cervical spondylosis, or the videos that talk specifically about neck pain, cervical radiculopathy, and cervical myelopathy. The most common symptom that people have with cervical spine problems and degeneration is neck pain. Neck pain is something we usually try to treat non-surgically. We very rarely will operate for neck pain, and I think that's something that we talk a little bit about in the management of cervical spondylosis. Having said that, first-line treatments for neck pain are really physical therapy. That's a common one, and on occasion people will do injections. If you've done injections and done physical therapy and the symptoms have maybe been going on for longer than 6 to 12 weeks, it's probably reasonable for you to see a spine specialist, maybe even a spine surgeon. You could see a spine medicine specialist or a non-operative spine specialist, and there are people like physiatrists that would do that. But I think seeing a spine specialist if your symptoms of neck pain have been not responsive to injections and physical therapy, certainly reasonable. With respect to symptoms that go down into your arms, if you're having cervical radiculopathy, the symptom of pain itself that shoots into the arm, this lightning bolt kind of pain that travels into your arm, maybe one or both arms, that is something that often we would recommend steroids for. It could be oral steroids first because it could be incredibly painful, but often cervical injections can be very effective for that. In general, the first-line treatment for cervical radiculopathy is going to be injections and also physical therapy. Now, people will do things like traction, other things right off the bat, and that's probably the thing to pursue before seeing a surgeon. But similarly, if your symptoms of pain into your arms have been going on for longer than 6 weeks, for sure, I think seeing a surgeon is reasonable. Certainly getting imaging, I think, is reasonable. If you haven't had injections, it's worth pursuing that as well first. Some people will do that first, or I will see patients who haven't had that but send them for that. But if you're noticing weakness in your arm, then it's probably more urgent to see somebody. If you're having problems with numbness and tingling, you can see a surgeon, but weakness is probably the most concerning finding of cervical radiculopathy that we encounter, and we usually want to see people sooner. Especially if you find the weakness to be interfering with your day-to-day quality of life. So let's say you're a carpenter and you have tricep weakness, you can't swing a hammer. That's a very different thing than if you sit at a desk and you have some tricep weakness. But if it's interfering with your function, whether it's work or other social recreational activities, probably worth seeing a surgeon to at least discuss your imaging findings and discuss management options. In general, we tell people surgery is a last resort. You really want to try all the non-surgical stuff you can, but you could certainly see a surgeon to have that discussion firsthand. If you have symptoms of cervical myelopathy, which is problems with clumsiness, dexterity, maybe buttoning your shirt, dropping things, using a zipper, or if you have balance problems, which comes from spinal cord dysfunction, then seeing a surgeon more urgently is certainly warranted. Most pain management doctors will pick up on that. A lot of primary care doctors will pick up on that. And if they find reflex changes or if you have those symptoms, they usually will refer you to a spine surgeon a little bit sooner. And that is because spine surgery in that situation for cervical myelopathy is usually advisable. It's not an emergency, but it's something we generally recommend. So I would say, in summary, if you have symptoms of cervical myelopathy, which again is like balance problems, clumsiness, dexterity problems, not necessarily pain, seeing a surgeon is worthwhile. If you have pain in your arm or neck pain that's really been going on for longer than 6 to 12 weeks, sure, I think it's valuable to see a surgeon in that situation as well. And if you have weakness that's really affecting your quality of life or your function, I think it's worth seeing a surgeon as well. This is really meant to cover when you should see a spine surgeon with degenerative problems of the neck, or what we call cervical spondylosis. Certainly seeing a chiropractor, acupuncture, other forms of non-surgical treatment, those are totally reasonable. A lot of people will do that. That's at your discretion or your primary care doctor's discretion. We're not really talking about some of the pathologies we see like tumors and trauma, fractures, infections, things like that in this video. This is really meant to cover when to see a spine surgeon when you have degenerative problems with the cervical spine. I hope you found this content useful. If you have any questions about this content or questions that you think I should answer going forward, please feel free to leave them in the comment section below. If you found this useful, please like and subscribe. It will help grow the channel. If you have any other things that you would like to see, please let me know. I appreciate your attention and I look forward to seeing you in Spine Academy videos coming up.